Hello, I'm Mark Pegram. I'm a medical oncologist at the Stanford University School of Medicine and the Stanford Cancer Institute. I'm the Associate Director for Clinical Research there and a member of the Breast Oncology Program. A frequently asked question from my patients after a diagnosis of breast cancer is what diet should they follow long-term to minimize their risk of breast cancer recurrence? And my answer presumes that the risk of recurrence may be similar to diets that are associated with risk of breast cancer in the first place. Stands to reason that if you follow a low risk breast cancer diet, then hopefully that diet would also translate into benefits for patients with a history of prior breast cancer who are now in remission and in long-term follow-up. And so it's been shown in cross-cultural clinical studies that a Western lifestyle, including a Western diet, significantly increases the risk of breast cancer. Therefore, low-calorie diets are ideal, certainly low fat, low cholesterol, low sodium, with lots of fresh fruits and vegetables. Dark green and leafy vegetables are good. Legumes are good. If you have meats, then lean cuts only and in moderation. If you enjoy poultry or fish, then there should be no skin because that contains a lot of the fat content. And certainly don't fry anything. That defeats the purpose of a low fat or low calorie approach. Ideally, no alcohol. In very large studies of alcohol consumption, there appears to be no lower limit that increases risk of breast cancer. So ideally, no alcohol, though I suppose for special occasions, birthdays, holidays, weddings, etc., the new year, then some moderation might be acceptable. But in large studies, no alcohol gave the best results in terms of breast cancer risk reduction. So the short answer for this complicated question is basically all the things that your mother probably told you to eat when you were growing up. She was right, it turns out. The fascinating thing about diet is if you take patients who are at low risk from other countries, let's say Southeast Asia or Sub-Saharan Africa, who have very low calorie diets, sustenance kind of diets, like rice and beans, for example. If you move those people to the US, then their breast cancer risk becomes the same as the US population after about a decade. And so that strongly implies diet as being a major risk factor for breast cancer in the West. And it is a controllable risk factor because you can indeed control your diet. So in summary, low fat, low cholesterol, low calorie, low salt, lots of fresh fruits and vegetables, legumes, and little or no alcohol is the best diet, in my opinion, for risk reduction for relapsed breast cancer.